Comlex Level 2 Performance Evaluation Exam. Erectile dysfunction in 62 years old male. Patient data sheet. Patient name, Mr. Edward Radulovic. Clinical settings, medicine office. Chief complaints, a 62 years old male present, with complaining of erectile dysfunction. Vital signs. Blood pressure, 130/74 millimeters of mercury. Respirations, 14 per minute. Temperature, 98.2 Fahrenheit. Pulse, 76 beats per minute, regular. Height, 69 inches. Weight, 153 pounds. Body mass index, 22.6 kg per meter square. Differential diagnosis. Diabetes mellitus. Medication-induced. Psychogenic. Neurogenic. Primary gonadal failure endocrinological. Key points to remember before entering patient's room. You should have patient's name, chief complaint and vital signs. Please have a differential diagnosis before entering room so you can ask specific questions. Patient might be shy about talking of his erectile dysfunction, so please make him comfortable and reassure him, so he can speak about it. Position of the patient. The patient will be sitting on bed. He might be shy initially to talk about his erectile dysfunction. How to make patient comfortable. Address patient by his last name, shake hands and introduce yourself. Explain him what you are going to do in next 15 minutes. Offer help, if they need during history taking and physical examination. Reassure and explain him for any of his concerns. Reiterate that all information will be kept confidential. Opening of the case.
Mr. Radulovic, good morning. I am Dr. Kendall. I am an attending physician in this hospital.
Shake hand.
Today I will take care of you. First I will ask you few questions, and do brief physical examination. Meanwhile, if you have any questions, feel free to ask me. Let me make you comfortable.
Drape patient at this time.
Okay, Doc.
Please tell me what brought you in today?
Doc, I have problem with my sexual life.
Subjective.
Please tell me what kind of problem you have.
Doc, I do not have enough erection anymore.
Tell me how long you have been having this problem?
Doc, about last 6 months.
Do you see any changes over last 6 months?
It's getting worse.
Do you have sexual desire?
Yes, Doc, I always want to have sex, but because of this problem I can't enjoy it.
Mr. Radulovic, I can understand how difficult this problem is. I will try my best to help you.
Thank you, Doc.
Do you have difficulty in initiating erection?
Yes, Doc, it takes a long time.
Can you maintain erection?
Yes, but for shorter time period.
Do you have any difficulty in ejaculation?
Yes, Doc, I sometimes have early ejaculation.
Can you achieve orgasm?
Yes, I can.
Do you have erections in the night or early morning?
Yes, I do.
Do you have any weakness in legs?
No, Doc.
Do you have any numbness or tingling in legs?
No, Doc.
Do you have any pain in legs while you walk?
No, Doc.
Do you have any chest pain?
No, doc.
Have you noticed any changes in urination?
No, doc. It's good.
Have you noticed any changes in bowel movements?
No, doc.
Do you have any conflicts with your partner?
No, doc. She is very understandable.
Have you had any injury to back?
No, doc.
Pam hugs Voss. Here, you should use transition sentence.
Mr. Radulovic, I would like to ask you a few questions about your health in the past.
Okay, doc.
Do you have high blood pressure?
Yes, doc. I takes hydrochlorothiazide 25 milligrams and atenolol 50 milligrams daily.
Is it controlled?
Yes, I check it regularly, and it is about 130/85.
Do you have high blood sugar?
Yes, doc. I am taking metformin 1000 milligrams 2 times a day.
Is it controlled?
Doc, not really. I check it occasionally, and most of the times it is above 200.
I see. Do you have high blood cholesterol?
Yes, I take Lipitor 20 milligrams at bedtime.
Do you have any other medical conditions?
No, doc.
Do you have any surgery?
Yes, I had prostatectomy 2 years back.
Medications.
Apart from the medications you told me, do you take any other medications, anything herbal or Chinese or over-the-counter?
No, doc.
Allergy.
Do you have any allergy?
No, doc.
Social history.
Mr. Radulovic, now I would like to ask you a few questions about your habits.
Okay, doc.
Do you smoke?
I used to smoke half pack per day for last 20 years, but I quit it 3 years back.
Take this opportunity to appreciate patients' smoking cessation.
I appreciate that you quit smoking. It will help you. Do you take alcohol?
Occasionally.
Do you take any recreational drugs?
No, doc.
Sexual history.
Now, I would like to ask you a few personal questions. I assure you that all information will be kept confidential. As you mentioned, you have been sexually active with your wife. Have you had any other partner recently?
No, doc. Only my wife.
Family history.
Now, let me ask you a few questions about health of your family members. Does anybody in your family have any medical conditions?
Yes, doc. My father died due to heart attack 5 years back when he was 80, and my mom died due to breast cancer when she was 72.
I'm sorry to hear that.
It's okay, doc.
Occupational history.
What kind of work do you do?
I work as a regional manager at insurance company.
Summarization of history in 2 to 3 sentences. Now you are done with history. It's time to summarize it.
Mr. Radulovic, thank you. I am done with history. Let me summarize for it. As you mentioned, you have difficulty in initiating and maintaining erection for last 6 months, that is getting worse with occasional premature ejaculations.
Challenging question.
Do you have any question?
Doc, I have seen ad of Viagra. Can you prescribe it for me, please?
Mr. Radulovic, I appreciate that you are aware of Viagra. That is good medication for problem like this, but I need to examine you, and make sure that it is right for you.
Okay, doc.
Points to remember before starting physical examination. Wash your hands. Always make patient comfortable. Ask permission to examine. Do not repeat painful maneuvers. Use proper draping techniques. Provide help during examination. Explain what you are doing. Explains, offers and performs OMM if indicated. Explain importance of rectal and genital examination. Focused objective.
Mr. Radulovic, now I need to examine you. May I proceed?
Please do focused physical examination.
General examination. Do it quick. Head, ear, eye, nose and throat. Carotid brute. Respiratory system. Inspection, auscultation. Cardiovascular system. Inspection, auscultation. GI. Mention genital examination and rectal examination in diagnostic workup. Extremities. Check pulse, motor and sensory function of lower extremity. Central nervous system. How to finish case. Once you are done with your physical, give him initial impression and explain your plan.
Mr. Radulovic, thank you for your cooperation. I am done with physical examination. Let me give my impression. Based on your history and my physical examination, it seems that you might have decreased blood supply to penis or nerve damage to it. But it could be something else. So, to arrive at right diagnosis, I will run some blood tests and order imaging study, such as ultrasound of the penis. I will call you to let you know results. I would like to see you in a week. Do you have any questions?
No, doc.
Shake hands and leave the room. Soap note. Subjective. A 62-years-old male came to clinic with complaining of not having enough erection for last 6 months. That is getting worse. It takes long time to have erection that lasts short period of time. It is associated with occasional early ejaculation. He has good sexual desire and achieves sexual orgasm. He also has nighttime erections. He denied any numbness, weakness or pain in legs, back injury, urinary and bowel complaints or appetite changes. He also denied any chest pain, shortness of breath and conflicts with partner. Review of system, negative except as above. Past medical history. Hypertension, hyperlipemia, diabetes mellitus. Past surgical history. Prostatectomy 2 years ago. Medications. Hydrochlorothiazide 25 mg daily. Atenolol 50 mg daily. Metformin 1 gram 2 times a day. Lipitor 20 mg daily. Allergy. None, no known drug allergy. Social history. Used to smoke 1/2 pack per day for 20 years, quit 3 years back, occasional drinker, no recreational drugs, lives with wife and sexual active with wife only, works as regional manager at insurance company. Family history. Father died at age of 80 due to heart attack. Mother died at 72 due to breast cancer. Objective. Vitals, within normal limit. General, well-oriented elderly male, sitting on the bed, without any acute distress. Head, ear, eye, nose and throat. Pupils equal, round, reactive to light and accommodation, external ocular movement intact, no pallor, icterus, lymphadenopathy and carotid brute. Respiratory system clear to auscultation, no additional sounds. Cardiovascular system S1, S2, regular rate rhythm, no murmur, rubs and gallops. Abdomen soft and non-distended, non-tender, breath sounds present, no organomegaly. Extremity no edema, bilateral pulse present. Central nervous system alert and oriented to person, place, and time, motor, 5x5 in lower extremity and sensory, bilateral equal. Assessment and plan. Assessment 1. Diabetes mellitus. 2. Medication induced. 3. Erectile dysfunction due to atherosclerosis. 4. Neurogenic. 5. Primary gonadal failure endocrinological. Plan 1. Sildenafil 50 mg once daily per oral 1 hour prior to sexual encounter, discontinue atenolol. 2. Genital and rectal examination. 3. Complete blood count with differential, basic metabolic panel, testosterone, prolactin, hemoglobin A1C. 4. Penile Doppler ultrasound. 5. Counseling about disease and its treatment. 6. Follow up in a week. We wish you happy reading.